staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show. Friday, March 16th. Happy spring break. Is there any parents or spring breakers down here in Florida happening to be listening to the show to keep healthy? I know it's probably not on the main part of your mind, but hey, you never know. But anyways, and to all of South Florida who's here as well listening, we're actually having Dr. Werner Andrade on the program today. He's a general and bariatric surgeon right here in South Florida. He's on staff at two different hospitals. One is Gables Hospital down in Miami, right near the University of Miami, within a stone's throw of South Beach there as well. And also Hialeah Hospital, which you probably heard. We've had a lot of doctors on the program from Hialeah Hospital lately. They have a great program, and actually I've been there 3 times in the last 3 weeks, and one of them was to actually visit Dr. Andrade's office to talk to him about coming on this show. Hialeah Hospital used to be a Seventh-day Adventist hospital, so they have some great artwork actually in the hospital and lobby that's still left over from before Tenet bought the hospital. And I always love, there's this one picture in there, and it's a picture of surgeon doing surgery with his staff, and then behind the surgeon is Jesus, and he is actually standing there, and he's got his hand on the surgeon's shoulder as to tell him, I'm here with you. Let's get through this. Let's get this individual healthy and on the path to a quality of life, which all surgeons do. So I'm always really happy to make a visit down there to Hialeah Hospital. It's part of the 10 hospital network for Tenet Health in South Florida. So they actually have 4 hospitals in Miami-Dade County, which is Hialeah Hospital, which we get a lot of physicians on from Hialeah Hospital. Palmetto General Hospital is a very big hospital, also in Hialeah, also part of Tenet. Then you have Coral Gables, which I mentioned, right? That's the southernmost hospital Tenet has in Florida. And then the 4th hospital that Tenet has in Miami-Dade County is North Shore Medical Center in Miami, which is actually the oldest hospital in the Tenet network for Broward and Palm Beach County, and huge history there as well. I actually worked with someone who was the first doctor brought on to North Shore Medical Center. It was actually her grandfather is the Dr. John Hilsenbeck, was the first doctor ever brought on to North Shore Medical Center. And he actually started the hospital program with the hospital. So that's claim to fame there as well, and very important for South Florida. And North Shore Medical Center, I believe it's over 65 years old. So a great institution there in Miami as well. And North Shore Medical Center is actually the flagship hospital for Florida Medical Center at Campus North Shore, which you always hear on this program. We always have doctors from Florida Medical Center. And if you're listening, the studio is here in Palm Beach County. And if you're listening in Palm Beach County, then you probably don't get to Florida Medical Center that often, but it's only a 30-minute drive with no traffic. I want to say that with no traffic. This time of the year, it can be a little tough. It's a 30-minute drive from right here in Boca Raton. So with traffic, I'd throw an extra 10 minutes on there. It's off of Oakland Park Boulevard, and it's actually known as Florida Medical Center at Campus North Shore, and that is Tenet Health's only hospital in Broward County as well. So as I wait for Dr. Andrade to call in, I'm going to give a few of his areas of interest, his bio as well. and then we'll have him call in the future. That's great. So Dr. Andrade, he came to the Tenet network just 3.5 short years ago, believe it or not, and he's able to do both bariatric surgery and general surgery, which is very important because not only does he do the surgeries for things like hernias, that's a general surgery. Also, you may hear a lot about gallbladders. We talk a lot about gallbladder on the show because I've asked a few general surgeons if more women get gallbladder ailments than men, and we've had them answer yes, and we've learned that on this program. So also does gallbladder surgeries as well, and then of course bariatric surgery, which 10-15 years ago may have not even heard the term. Maybe 20 years ago never even heard about bariatric surgery, but it's definitely something that's come to the forefront, and it deals with weight loss. So anyone with a body mass index, I believe it's over 40, we'll have to ask the doctor. There's a number that goes there, and that's taking from your height, your weight, your circumference. So anyone who has a body mass index, I think it's 35 or 40. I'll have to ask the surgeon. It's right in that range. I'm sure that anyone with a body mass index of that caliber can be someone who qualifies for bariatric surgery. And the way bariatric surgery works is they normally, to be clear, to be blunt, they just shorten the stomach. Whether they staple it shut or they do a pouch, is just something that they're able to do to shorten the stomach size and make you feel more full, so you're not overeating as well. So that's important because the less calories you're taking in, obviously, the less amount of weight you're gaining. And if you're burning more calories than you're taking in, hey, you're losing weight. So that's a great thing, and they can help with that. So that's what bariatric surgeons do as well. So I'm going to talk a little bit about the two surgeries that I know Dr. Andrade does. One of them is a gastric bypass, which is pretty common nowadays. And the other one is a gastric sleeve as well. But if you want to learn more about Dr. Werner Andrade, he's actually in this month's issue of South Florida Hospital News and Healthcare Report. It's something I pick up often. I see it in all the hospitals. I see it in all the waiting rooms that I go into, and I'll tell you, I go in a ton of doctors' waiting rooms. If you don't know what I do outside of this show, people will tell you that I'm probably in 15 doctors' waiting rooms a week, believe it or not, from Coral Gables to Jupiter. So it's a publication I always see in the studio, the doctor's office. I'm in the studio. The March 2018 edition of South Florida Hospital News and Healthcare Report has a salute to physicians. So this is a profile that they do on certain doctors that are selected for the profile. And for March, for Tenet Florida Physician Services Hialeah office, Dr. Werner Andrade is featured. So Dr. Andrade is known for his compassion when discussing body mass index, which we talked about. So body mass index in adults who face health issues tied to morbid obesity. So, like I said before, you have to have a certain body mass index before you can even qualify for bariatric surgery. And then I believe it's 6 months to a year where you work with not only a dietitian, a support team, to work on the way you eat, because you just don't go in and have bariatric surgery. That's not the way it works. You have to lose a certain amount of weight before the doctor will even sign off for you to go under. So that's a huge part of the process, pardon the pun. But then you go on a strict diet pretty much for the rest of your life. And it's all about portion control as well, and certain things you can eat. Actually, my my sister had bariatric surgery last year, and I think she's lost close to 100 pounds. She looks like a whole nother person. So I was able to talk with her a little bit about the surgery. And, yeah, you have to learn how to eat and stop yourself before you're full, because one of the things that people who have had bariatric surgery will tell you is that if you overeat, you're never going to overeat again, because it's not that it's painful, but there's a very big discomfort coming from the smaller stomach. And surgeons have told me that as well. That's one of the things that patients tell them they know when they overeat, because they pay for it for like 2 to 3 hours of, just discomfort in the stomach. So because the stomach has been made smaller by the surgery. So Dr. Andrade, he's known for his compassion when discussing body mass index, which is important because there's a lot of discussions that go on before the surgery is actually scheduled. And with issues with people who face health issues tied to morbid obesity. So that's obesity that can cause death. So whether it's a heart attack or diabetes, which we talk a ton about on this program, because we're discovering, or the doctors, I should say, is discovering that diabetes is creating a whole number of ailments, and especially diabetes caused by people that are overweight. So Dr. Andrade and his devoted office staff at Tenet Florida Physician Services, TFPS, you can check them out at tfpsdocs.com, or actually drwernerandrade.com. So they're in Hialeah, right? They're part of the hospital complex. You literally pull into the parking garage, and it's connected to the complex that Dr. Andrade's office is, and a whole bunch of other doctors. He's in there with Dr. Roger Pons, colorectal and general surgeon as well. And then there's a whole bunch of physicians as well. They do a lot of maternity, so there's a lot of OBGYNs, so obstetrics and gynecology. And they're also known for their neurology program as well. So you have a whole bunch of doctors right there. And you may be wondering, Hialeah, well, that's down in Miami, but nowadays people are searching online, and the info that they get, and once they can, they're able to, confirm that info is correct. So hopefully all hospital systems are putting out the correct info. Then, people are making choices to go have surgeries where they're comfortable. I'll tell you, if anything ever happens to me, I'm definitely checking Mayo Clinic in Minnesota before anyone else. And I work for a hospital system, so that's something that I know people are doing. We're going to take a quick commercial break, and I'm going to see if I can find my doctor. And if not, I have a lot to talk about on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Hello, South Florida and beyond, and we're back on the How to Stay Healthy show, sponsored by All County Healthcare. I got to say kudos to them for putting on this show where we talk every week to surgeons, primary care, and endocrinologists. We've had a lot of those on lately here on the radio every Friday, 5:30 to 6, and Tuesdays, 6 to 7 on the radio as well. So I'm going to talk a little bit more about Dr. Andrade, and hope I get him, but if not, we'll have him on in the future. Maybe something happened. Is that Dr. Andrade? Okay, awesome. Hey, Dr. Andrade.
Oh, hi, how you doing?
Good. Thank you for calling in. I was just telling everyone about you.
Oh, thank you so very much appreciated. I hope you tell them good things.
I did, and we were just talking about, there's an article in South Florida Hospital News right now, the March 1st edition, and it features you. It's Salute to Physicians. So I was talking a little bit about that because it has a lot of info about your areas of interest. But I want to get right into it. We talked a little bit about body mass index, and I want you to tell the listeners, again, I know you've been on the show a few times, but what it is, because I may have got it wrong. I wanted to say it's between 35 and 40, and then you qualify for bariatric surgery, but correct me, please.
Yeah, thank you very much for the invitation. The body mass index is the relation between the height and the weight. A normal person, and you can calculate this in your cell phone or your laptop, you're just going to body mass index calculator. So a healthy person with a normal weight should have a BMI between 19 and 25. When you have a BMI more than 25, you are considered overweight. When you have a BMI more than 30, a person is considered obese. But when you have a BMI more than 35 with one or more diseases associated with obesity, that's considered morbid obesity. And morbid obesity means that a patient has reached such a weight that puts at risk their health and their life. And when you have a BMI more than 40, you don't need to prove that you have any diseases. Just by the number itself, a patient is considered morbidly obese.
Oh, I see. So I was kind of right, but it's great to hear, from the actual doctor himself. We're here with Dr. Werner Andrade with Tenet Florida Physician Services, on staff at Hialeah Hospital and Coral Gables Hospital. He's bilingual in English and Spanish. And I'm going to give out his info in a little while because I know people are searching online about different ailments. Dr. Andrade, correct me if I'm wrong. Also, you do the gastric bypass and gastric sleeve. Are those the two bariatric surgeries you offer?
Yes, that's completely right. First of all, I want to say that I'm also very honored to be the director of bariatric surgery at Hialeah Hospital. Probably you already mentioned it. And as a director, we have made an amazing program at Hialeah Hospital. In Hialeah Hospital, we offer a wide variety of weight loss surgery procedures. Number one, the balloon. The balloon is the one that you insert with endoscopy, with a camera, and doesn't involve any general anesthesia. We keep the double balloon in the stomach. The patient feels full faster, and that's how the patient loses weight. And we keep this balloon for 6 months, but we put the patient on their nutritionist follow-up for the next 6 months to prevent for the weight to come back. Second procedure that I perform is the lap band. The lap band is a silicone ring that you put at the beginning of the stomach, and then you adjust it every 2 months in my office, and the patient gets full faster. The third procedure that is the most popular of all, and is the most commonly performed in the United States nowadays, is the gastric sleeve. In Spanish, la manga gastrica. This is a beautiful procedure because the only thing that you do is reduce the size of the stomach, and you leave the stomach like the size of a banana. That's the reason a lot of my patients come to my clinic and they say, "Doctor, I want the banana procedure," and I know what they're talking about. And not only that, it decreases the appetite significantly. So it's not the food controlling the patient, but the patient in control of the food. The other procedure that I do is the gastric bypass. The gastric bypass involves cutting the stomach into a smaller size and cutting the small bowel and put it back together with the stomach. It's a more complex procedure, but it's the one that makes you lose the weight more than any other procedure. And the last one is revisional bariatric surgery. For those patients who have had surgery way in the past and that they have regained some of the weight, that the risk to do that is 10%, we can also convert a procedure to another procedure.
Oh, okay. That's good to know. I didn't know that that
Exactly.
you offer that, and you offer so many different options. That's great.
Oh, yeah. And for example, the lap band is not as popular as it was in the past. So some patients, not all, have regained the weight. So you can convert a lap band into an sleeve or into a gastric bypass, that they are more effective procedures.
Dr. Andrade, now there's a process that goes along with the bariatric surgery decision. I know that you and your staff work closely with the patient and dietitian, and then you even before that, you provide a seminar at the hospital. Is it once a month where you're actually there giving info out?
Yes, exactly. At Hialeah Hospital, the second Wednesday of the month, I provided a free seminar, and in which I explain to the patient what is what is obesity and what is the treatment. I also have to mention that we have free parking in our seminars.
Oh, nice. That's good to know. Always something to add on, because it is. I'll tell you, I've been there 3 times in the last 3 weeks, and been there a few other times, and it is actually an easy hospital getting in and out of. What I like about it is you park, and whether you're going to your office or the hospital, you can. It's all connected. So once you park, you're good to go, and it's a short walk. So
exactly. And let me tell you, I was very blessed to be trained at Cleveland Clinic in Ohio. That is one of the top hospitals in the United States. So and I can tell that Hialeah Hospital is an amazing hospital. Our program, I have tried to keep the same standards that I learned for our program, and I'm very proud of it. The reason we do these seminars is to educate the patients. You know, when you mention bariatric surgery, it creates anxiety. Oh, do surgery. It creates anxiety in every patient. So the best way to prevent anxiety is by education. So we're very proud to educate our community.
And that's right. Dr. Andrade, he did his residency at Cleveland Clinic. That is outstanding. I interview a lot of doctors. I don't see that very often. And fellowship, Tampa General Hospital, University of South Florida in Tampa, advanced laparoscopic and GI and bariatric surgery. So fellowship trained doctor right here. Board certified as well with the American Board of Surgery. It's Dr. Werner Andrade. drwernerandrade.com is his URL online. So look him up and take a look. He just told us about some of the. Oh, thank you for making the time, Dr. Andrade. Now, I want to ask you, we're ripping through a lot of different things here, but can you talk a little bit about the diet even before bariatric surgery, and what kind of diet someone will have to be on afterwards? Because sometimes what people worry about is if what they're going to be able to eat, you know? I mean, eating is emotional, right?
Yeah, exactly. And you have brought something very, very important. Every patient has to remember that the bariatric surgery, the weight loss surgery, is just a tool. But the patient has to do changes in the lifestyle by eating healthier and doing physical activity. Before the surgery, the patient, depending on the insurance company, the patient is on their supervised diet from 3 to 6 months before the surgery, either with the primary care physician, with myself, or with a nutritionist. Because we want the patient to lose some weight before the surgery. Just before the surgery, I put all my patients in a 2-week liver reduction diet. This liver reduction diet is a special diet that aims to decrease the size of the liver, and that makes the surgery easier and safer for the patient. And then, after the procedure, we advance the diet from liquid diet to puree to soft diet and regular diet when the patient reaches 6 weeks after the procedure. This is the most important and critical part of the whole bariatric surgery process. We teach the patients to eat 5 times a day. By doing so, the metabolism increases and the patient loses even more weight, burns more fat. And it's a high protein, low sugar diet.
Oh, that's great. I mean,
it's not only the surgery. I follow the patients. I work with the patient together for 1 year. I see the patient at 2 weeks, 1 month, 3 months, 6 months, and 1 year after the surgery to increase the chances of success.
Wow, that's good to know. That's extensive. So you're with the patient, for the whole next year at least. So that's great news as well. We're here with Dr. Werner Andrade. He's a general and bariatric surgeon with Tenet, Florida Physician Services and Hialeah Hospital, where he's the medical director of bariatric surgery, and then also on staff at Coral Gables Hospital. And you can check him out at drwernerandrade.com or give his staff a call at 305-691-0118. And like I said, he's located right on the campus of Hialeah Hospital. Dr. Andrade, do you also do a couple other different types of surgery? I know you're also becoming well known for hernias, right?
Yeah, exactly. As you mentioned before, I am not a general surgeon who decided to do weight loss surgery. I am a bariatric surgeon. I have a fellowship in weight loss surgery and also advanced laparoscopic surgery. So my main training from Cleveland Clinic and Tampa General Hospital is minimally invasive surgery, everything that is done with video camera. So besides the weight loss surgery, I also do advanced laparoscopic surgery that is like hernia repair, gallbladders. I do all types of colorectal and the small bowel surgery, and also surgery for reflux, like laparoscopic mesentery duplication and hiatal hernia repairs, all by laparoscopic means. But I like to be up to date with the technology. Not only I do this with video camera, but I do most of these procedures and most of all my procedures by robotic means. I do a lot of my practice is robotic surgery.
Oh, is that what that Da Vinci robot that we hear about?
Exactly. Most of my sleeve gastrectomies, gallbladder surgeries, hernia surgeries, I do them with the video camera using the Da Vinci robotic system.
And that's, like you said, minimally invasive. So tell us briefly, minimally invasive. So that's a small incision, so there's really not much of a scar. You're not opening up the body much, and you're still able to get in there?
With advanced laparoscopic surgery, you just do minimal incisions. The incisions are approximately 1 centimeter. And, hello?
Hello, Dr. Andrade. I'm sorry we're running out of time, so I want to have you on again, maybe every month. So thank you for coming on the program.
Okay, thank you so very much. I enjoyed the interview, and I do appreciate the invitation.
And we'll see you next time on the How to Stay Healthy show.
Okay, take good care, baby. Bye.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.